In this video, we will see about the intravenous route. In this route, the drug is injected as a bolus or infused slowly over hours in one of the superficial veins. Now we'll see the materials required. The materials required are as follows: an alcohol-based hand rub, spirit, cotton ball, gloves. In IV route, we'll be using a tourniquet to be able to access the vein better. IV route is split into two types. First is the IV bolus, for which we'll be using two types of syringes, a 5 ml syringe and a 10 ml syringe. Next is IV infusion, for which we'll be using solutions like Dextrose or Pantoprazole. Then we'll be using an IV drip set and Venflons. There are two types of Venflons, a regular Venflon and a butterfly Venflon for emergencies. Sites of administration. The most common site of administration is the dorsum of the hand, wherein we'll be using the dorsal arch veins. On the lateral aspect of the forearm, we'll be using the cephalic veins. The next most common site is the cubital fossa, in which we'll be using the median cubital vein. In conditions wherein the upper limb veins are inaccessible, like in burns, we'll use the lower limb veins. The most common sites are the knee and the ankle, wherein we'll be using the Saphenous vein. The drugs given in this route. These are the indications and contraindications. First, we'll see the IV bolus route. Before starting any procedure, wash your hands, explain the procedure to the patient and get their consent and reassure them if necessary. Once that is done, uncover the area to be injected completely. We should tie the tourniquet above the area to be injected. In this case, since we are using the median cubital vein, we will be tying the tourniquet in the area above the cubital fossa. Look for suitable vein. Once that is done, disinfect the skin with alcohol wipes. Then, stabilize the vein by pulling the skin taut in longitudinal direction by the other hand. Then choose the appropriate syringe and load it with the required amount of drug to be administered. Insert the needle at an angle of 25 degrees. Puncture the skin and move the needle into the vein. Make sure to hold the syringe and needle steady. Aspirate briefly to check if it's in the vessel. Then loosen the tourniquet and inject slowly. Check for pain, swelling and hematoma. Then withdraw the needle swiftly and press sterile cotton onto the opening for a few seconds and fix it with adhesive tape. Once that is done, clean up and dispose the waste safely and reassure the patient once again if necessary and wash your hands. Next is the IV infusion. First, we'll see the parts of an IV drip set. The components of an IV drip set are as follows. First is the piercing pin or the bag spike, which is used to attach to the IV bag. Then comes the drip chamber through which the drug flows before going into the tubes. It acts as a pressurizing chamber. Next is the roller clamp, which is used to regulate the flow of fluids. This is the injection port. And the needle end, which is used to attach to the Venflon. This is the IV drip stand. Now we'll see the parts of a Venflon. There is a lower lock plug, flashback chamber, needle grip, lever connector, injection port cap, valve, the catheter hub and wings, then the bushing, the catheter and the needle. Now we'll see the procedure. First, wash your hands, reassure the patient, explain the procedure and get their consent, and then arrange and inspect the integrity of the equipments. To do that, we need to set up the IV drip set. We'll set up the IV drip set by the following method. Choose the appropriate solution to be administered and hang it on an elevated stand. Then, using the back spike in the IV drip set, insert it into the appropriate port given in the IV bag. Make sure the drug flows into the tube and remove air bubbles using the roller clamp as shown in the video. Once that is done, we need to choose the appropriate vein in this site to be injected. Then tie the tourniquet. Here we are using the cubital fossa for convenience. In an actual patient, we will use the dorsum of the hand. Then disinfect the skin over the vein with sterile cotton soaked in spirit. Stabilize the vein by pulling skin taut in longitudinal direction by the non-dominant hand. Then insert the needle at an angle of 25 degrees. Puncture the skin and move the needle into the vein. Make sure to hold the syringe and needle steady. Aspirate briefly. Then remove the tourniquet. Make sure the Venflon is stable at all times. Then stabilize the Venflon using a micropore tape. Once the Venflon is stable, insert the IV set connector into the cannula. Open the clamp and adjust the flow rate as per prescription. Then check for pain, swelling and hematoma at the site of injection. Once that is done, paste a tape with the date and time of the initiation of the IV. Once that is done, remove the gloves, wash hands and dispose the waste appropriately according to biomedical waste management guidelines. These are the complications, the advantages and disadvantages. Thank you.